This presentation is about sexually transmitted disease prevention in Pitt County, North Carolina. The 2015 Pitt County Community Health Needs Assessment is a joint effort between Pitt Partners for Health, Vidant Medical Center, Pitt County Health Department, and East Carolina University. The purpose is to determine the health priorities that will be the focus for the community health improvement over the next 3 years. Key findings from the collection of primary and secondary data by the CHNA team, the community's concerns were categorized to align with the North Carolina 2020 A Better State of Health. According to the 2015 Pitt County Community Health Needs Assessment, during the years of 2011 to 2013, Pitt County ranked the ninth highest in North Carolina in terms of HIV rates. 75% of these HIV cases were males, and a total of 68% of these cases were among African Americans. Chlamydia cases reported in Pitt County also ranked among the highest rates in North Carolina. The rates of chlamydia in Pitt County alone are above those for the entire state of North Carolina. Gonorrhea cases also exceed the state's rate. Pitt County conducts thousands of STD screenings each year. In 2014, over 4,000 HIV, syphilis, and chlamydia screenings were completed, as well as over 6,000 gonorrhea screenings. During the windshield survey, we have discovered that the city of Greenville is composed of land bordered by roads. It is surrounded by smaller cities and has railroad tracks that run through the city and on the outlying cities that transport caustic materials. Per the greenvillenorthcarolina.gov website, there are 248.35 miles of streets, which include 247.61 miles of pavement. Greenville Public Works is in charge of keeping debris off the streets. Housing consists of many college-based housing developments secondary to the presence of ECU and other educational systems. The majority of housing in Greenville has central heating and air, plumbing, and sodded yards. Many of the newer houses are built with garages. There are approximately 10 to 12 feet between most homes. If construction has to be done, a city permit is required to ensure that new construction is completed within code. Greenville is well known for being home of the East Carolina University Pirates. Greenville is an educational city that includes East Carolina University as well as satellite colleges. There are also multiple public schools and several private schools. Greenville has an ample amount of open spaces and condemned areas. The city has redesigned many of these areas into parking decks, playgrounds, and new housing developments. Some other open spaces include dog parks and nature walking areas. And since sports are popular, a lot of spaces have been converted into different fields that Greenville charges residents $30 an hour to rent, and non-residents are charged a higher rate per hour. Greenville has a strategically located park referred to as the Town Commons. The park is between downtown and the Tar River. This common area includes a stage, walking trail, playground, and picnic areas, and is often used for community events, fundraisers, and concerts. Most people in Greenville drive their personal cars, others walk or catch an Uber or cab, or they may ride the Greenville Area Transit, which is a bus system transporting individuals all over Greenville between the hours of 6:25 a.m. until 7 p.m. Monday through Friday, and 9:25 a.m. until 6 p.m. on Saturday. Bus services are not offered on major holidays. Stores include many restaurants, a mall, many single stores, and then there's multiple sex stores located in Greenville. During the hours of 7 a.m. until 7 p.m., the streets are pretty busy, filled with cars, buses, people walking and riding their bikes all around town. And during this assessment, a lot of homeless people were noted, especially in low-income neighborhood areas. Many families were seen sitting on their porches or out in the yard interacting with their kids, especially between the hours of 5 and 7 p.m. Most dogs are treated more like a family member, and there's a leash law where not many loose animals are seen around in Greenville except in the country parks. There's a noise ordinance in Greenville, and individuals have to apply for a noise permit if one wants to have amplified noise, and a $100 fine is associated with a noise violation. Greenville is a growing city and it has become a very nice area to live. The city has a Community Appearance Commission that meets and helps to maintain and improve the private and public property throughout the city. The city has a strong college presence, so it's hard to maintain and upkeep property sometimes. Most neighborhoods have an ordinance that helps keep the area in good shape, and trash and recycling collections are on a schedule to minimize waste. Per the 2015 census, the population in Greenville included 90,597 people. It's a very diverse city, and it's also full of different types of religious groups, examples including non-denominational churches as well as denominational churches. Greenville encompasses Vidant Medical Center, which is a level 1 trauma center. Other healthcare facilities include a step-down emergency room and several urgent care practices. There are several independent primary care clinics, as well as specialty clinics. There are also emergency medicine technicians located throughout Greenville at EMS stations or fire stations, some of which are ACLS trained. For individuals with lower income or cannot afford insurance, there is a local health department and Department of Social Services. Pitt County Courthouse is located in downtown Greenville. There are 5 voting districts and 1 non-voting, and then Greenville has 21 active boards and commissions. Greenville's growing economy is based upon a well-established manufacturing companies located in the Industrial Park, which is in the northern section of the city. The Industrial Park includes 5 pharmaceutical and chemical businesses, 12 manufacturing companies, and 2 life science educational businesses. The life science businesses are located within Brody School of Medicine, which is next to the Vidant Medical Center at East Carolina University. The Windshield Survey was conducted on Greenville, North Carolina. It is growing and a college town, so a large number of the city's population is comprised of college students. During college years, individuals are more sexually active and STD rates tend to increase. WNCN reported that Pitt County Health Department is trying to tackle this growing problem by offering STD screenings, handing out free condoms, and providing traveling clinics throughout the county. While the health department is making great strides, the efforts are being challenged by the fact that local sex stores in the area are promoting risky sexual behavior. But each of these establishments fail to promote safe sex with the use of condoms and contraceptives. Despite the influence that these novelty stores may have, Greenville continues to be proactive in its efforts to prevent the rise of STDs by providing education to the youth. In Greenville, sex education is introduced to children in the 6th grade. One drawback is that parents have to approve of this course. Therefore, educating both student and parents on statistical data pertaining to STDs in Pitt County is a critical part of nurse education and should not only be done at the local health department, but in the school systems, college clinics, and community health fairs. Mr. Bill Cleve, Vidant Medical Center's public health epidemiologist, was contacted to interview in order to obtain more information regarding STDs in Pitt County. These are just a few questions that were sent to him. In Mr. Cleve's response to the interview questions, he agreed that Pitt County does have high rates of STDs along with all of eastern North Carolina, and he went on to state, "I would ultimately like to see a Vidant Health Foundation grant targeted at reducing STDs in our surrounding counties. I think this is just basic health and would be good for PR. Since every health department is different, and it is difficult to write a grant that meets everyone's needs, I want a Vidant Health grant to each county in our region for a certain amount of money, and the only request is to use the funds to reduce STDs in the individual county as they see best. It is a big project." The population has increased by 4.3% in Pitt County from 2010 to 2014. In 2009 up until 2013, females have represented the majority of Pitt County. The population distribution by race and ethnicity for whites and the Hispanic and Latino population are lower than North Carolina overall, but the African American population is higher. The most common language other than English spoken in Pitt County is Spanish. The estimated median house value in Pitt County as of 2015 was right over $138,000 compared to the state median of $160,000. The most common race or ethnicity living below the poverty line in Pitt County is African American, and females ages 18 to 24 represent the largest demographic by age and gender living in poverty in Pitt County. Some of the other higher paying industries in Pitt County are quarrying, oil and gas extraction, along with the lowest paying jobs as arts, entertainment, recreation, and food services. In December of 2016, Pitt County's unemployment rate was roughly 5.7, with right over 83,000 people registered as employed and 5,000 registered as unemployed. According to the 2015 Pitt County Community Health Needs Assessment, heart disease was the leading age-adjusted death for Pitt County residents, and cancer was the leading cause of death among all ages. Risk factors for these leading causes of death include high blood pressure, elevated cholesterol, diabetes, smoking, and obesity. Pitt County's female breast cancer rate and the prostate cancer rate both exceeded that of the North Carolina's rate. The burden of STDs fall disproportionately on disadvantaged populations in Pitt County, including youth and minorities. The goal to improving the sexual health of this diverse population of the disadvantaged includes providing culturally competent care and tailoring traditional strategies to enhance outcomes that better meet the individual needs of this population. To accomplish this, we must increase our understanding of how and when to apply current strategies or when to develop new ones by continually evaluating public health programs and other STD services within Pitt County and the surrounding communities. In these charts, rates are expressed as cases per 100,000 population. STDs, including HIV, affect many individuals in Pitt County each year. The county has not only struggled with the increase in HIV in the area, but also have had some of the highest rates of AIDS in North Carolina. HIV cases in Pitt County have increased by 31% since 2010, with 32 new cases reported in 2015 alone. As you can see in this slide, co-infection with HIV and syphilis is present in Pitt County. These STDs, which are preventable conditions, can lead to reduced quality of life as well as premature death and disability. In this table, you're able to see that both gonorrhea and chlamydia continue to be health concerns for Pitt County. In Pitt County, in 2015, there were over 6,000 gonorrhea screenings and over 4,000 chlamydia screenings. The North Carolina Division for Public Health and Technical Assistance and Training Program nurses are working to continuously support county involvement to improve adherence to treatment guidelines and ensure that the correct treatment for gonorrhea is being delivered to all populations. Disparity by race and ethnicity is particularly large for gonorrhea. Chlamydia is the most prevalent reportable STD in North Carolina, and there are no exceptions for Pitt County, as they were ranked 4th worst in the state in 2014 for cases of chlamydia. This infection can cause infertility and pelvic inflammatory disease in females. Infants born to pregnant mothers with active chlamydia are also at risk for infection. Community health has 3 common characteristics known as status, structure, and process. Assessing community health in terms of status or outcome is the most accepted approach. This involves identifying physical outcomes that can be measured by assessing morbidity and mortality rate and risk factors. For example, those identified in the Pitt County Health Statistics slide. The summary comparison provides an at-a-glance summary of how Pitt County compares with peer counties on primary indicators such as mortality, morbidity, healthcare access, quality, health behaviors, social factors, and physical environment. Assessing community health in terms of structure identifies services and resources that are available within the community. Defining community health in this manner includes evaluating the characteristics of the community. For example, education, employment, and health are all linked in Pitt County. Higher education levels are often associated with an increased participation in health-promoting behaviors. Percentage of adults who have an associate's degree or higher in Pitt County is 38%, and then 24% of individuals are estimated to be living in poverty in Pitt County. Low-income areas are less likely to have access to health care, and studies reveal adolescents who grow up surrounded by poverty are more likely to engage in risky sexual behavior, thereby increasing their chance to develop or spread STDs. Lastly, assessing community health in terms of process. This is the evaluation that addresses the effectiveness of processes that have been established within the community. For example, are the strategies implemented and function properly? A prime example is the work that is done by all parties to complete the 2015 Pitt Community Health Assessment, which provided the opportunity to achieve specific goals and develop timeframes to reassess based on the growing demand for change. An article published by the Population Health Improvement Partners of 2017 highlights how the Pitt County Health Department developed a team of individuals to participate in quality improvement programs to help tackle the community problem of sexually transmitted diseases. Despite Pitt County's numerous health resources, residents continue to report the need for assistance with access to affordable and timely health care services, although they also view the existing resources as a huge asset. According to the Pitt County Community Health Needs Assessment in 2015, a community health opinion survey was conducted and surveyed nearly 550 people who live in Pitt County. Some results reported that problems with poverty is an issue and upsets the quality of life in the county. Services are needed for supportive teen positive activities, and the survey respondents also reported their children need more education on sexual health. They also reported that care access is an issue due to the inability to obtain an appointment, due to increased costs, long wait times, and no insurance coverage. The biggest issues discovered among Pitt County residents included no health insurance and the inability to afford care or prescriptions. Current assets in Pitt County identified to address these major health problems include health care facilities and programs, mental health facilities, community and faith agencies, recreational facilities, and assistance programs. Current barriers identified to the major health problems in Pitt County include lack of accessibility to the healthcare system due to lack of health insurance, affordability of healthcare and prescription drugs, lengthy wait times for appointments and services, and lack of collaboration or coordination among community members and healthcare providers. Individuals' comprehension of disease and plan of treatment were also viewed as a barrier. Some strengths regarding healthcare in Pitt County include its facility resources such as Vidant Medical Center, East Carolina University, Brody School of Medicine, East Carolina Practices, Pitt County Health Department, James D. Bernstein Community Health Center, and private practices. Vidant Medical Center not only serves Pitt County but also 28 other counties in eastern North Carolina. Vidant has implemented strategies to help support the community with access to care and disease prevention. Pitt Partners for Health is a community resource that is made up of members throughout the county along with healthcare providers who help to recognize the health needs for Pitt County. The Pitt County Health Department offers many preventative services, screenings, and clinics that meet needs of the county, including family planning, women and children's services such as WIC, immunizations, and STD and communicable disease prevention. The James D. Bernstein Community Health Center offers care on a sliding scale fee to those who do not have insurance or have little insurance coverage. They also have a pharmacy with lower costs. The center is a federal center operated by the Greene County Healthcare Incorporation. The Bernstein Center does have a wait list for services, but Greene County offers other services to Pitt County, and there are services in other nearby counties available to Pitt County, such as the Kempton Community Health Center in Lenoir County. Nursing diagnoses to recognize will include knowledge deficit related to STD prevention, risk for infection, and ineffective health maintenance. After a June 2015 meeting, Pitt Partners for Health identified access to care as the top priority to address to improve on Pitt County, followed by the topics of chronic disease prevention and physical activity and nutrition for the years of 2015 to 2018. The Pitt County Community Health Needs Assessment of 2015 and the Pitt County Board of Health identified sexually transmitted diseases as one of the 3 top health categories to focus on improving from the year of 2015 to 2018. Interventions to help these significant issues related to sexually transmitted disease prevention in Pitt County can be identified through primary, secondary, and tertiary levels. Primary prevention is so important and one of the biggest areas that needs focus. Ideas such as volunteer-based clinics and health screenings and an increase in education on STD prevention and safe sex practices would be very beneficial to the community. Reviewing educational standards may also be of key importance to ensure that the proper tools are being provided to the population most affected by these health issues. Promotion of regular health screenings is vital, as well as really making the community aware of the resources available, even for those who are financially unstable. When these primary and secondary interventions are not in place, and in the event of the occurrence of an STD, promotion of prompt and consistent medical treatment is key. The Centers for Disease Control and Prevention estimate that there are approximately 19 million new sexually transmitted disease infections each year, almost half of them among young people ages 15 to 24. The cost of STDs to the U.S. healthcare system is estimated to be as much as $15.9 billion annually. Untreated STDs can lead to serious long-term health consequences, especially for adolescent girls and young women. CDC estimates that undiagnosed and untreated STDs cause at least 24,000 women in the United States each year to become infertile. Access to care and improvement in financial services is a great need in Pitt County. Educating the populations in need of available resources is also important and could assist in STD prevention. Overall, primary prevention is of most importance, but in the event that it is not accomplished, early treatment and consistent follow-up will help prevent further complications that STDs could cause. In conclusion, by conducting the community health assessment of Pitt County, we have learned that sexually transmitted diseases are a major health concern, not only for this community, but throughout the entire state of North Carolina. We have identified that education and primary prevention is the best approach to obtaining measurable outcomes. Continued collaboration between healthcare partners to increase the man-hours of education, surveillance, and treatment is key to decreasing STD rates in Pitt County.